Good morning, everyone. It's 11 o'clock, so we'll go ahead and get started. Thank you for joining us today. This is the Rock County Public Health Department media briefing for September 30th, 2021. We start with some remarks from the Rock County Public Health Department, and then we will go to our media partners for questions. I'm Jessica Turner. I'm the Communications Specialist for the Rock County Public Health Department. And today I have with me Katrina Harwood, Health Officer, Nick Zupan, Epidemiologist, and Seth Longcar, Administrative Services Supervisor. So we will start, as we always do, with our data updates from Nick.
All right, thanks, Jessica. So in terms of the total number of COVID cases we've had over the course of the pandemic, we're up to 18,737 Rock County residents who have tested positive. Based on our current numbers, we're averaging about 37 new cases per day over the last week. So we're still seeing high case activity. We're not seeing kind of ongoing steady increases, but still seeing pretty high case activity in the community. We have about 770 active cases right now across the county, and there have been 198 deaths due to COVID-19. Our hospitalization numbers are down a little bit. Most recently, we had 13 patients in the hospital getting care for COVID-19. And in terms of our vaccination levels, we're almost to 56% of our Rock County population having received at least one dose of the vaccine, and nearly 53% have completed the vaccine series. So that's all I have for a data update today.
Thank you, Nick. We are going to go now to Katrina for our main topic.
Thank you, Jessica. Today, we wanted to share some additional information regarding booster doses. Millions of Americans are now eligible for booster doses, and at present, the CDC and Wisconsin DHS are recommending Pfizer booster doses 6 months after the second dose for a variety of individuals. This includes adults aged 65 and older, all residents living in long-term care facilities, and adults ages 50 to 64 who are at high risk of severe COVID-19 due to underlying medical conditions such as cancer, chronic kidney or lung or liver disease, dementia or neurological conditions, diabetes, Down syndrome, heart conditions, HIV, immunocompromised conditions, pregnancy, obesity, sickle cell disease, smoking, organ or stem cell transplant patients, stroke or cerebrovascular disease, and substance use disorders. The CDC and Wisconsin DHS have also communicated that the following additional groups may secure Pfizer COVID-19 booster shots based on their individual assessment of risk and benefits. Adults ages 18 to 49 who are at high risk of severe COVID-19 due to underlying medical conditions like those listed earlier may consider a booster in consultation with their medical provider based on an assessment of their individual benefits and risks. Adults age 18 to 64 whose jobs put them at high risk for COVID-19, such as first responders, education staff, and those in food and agriculture, manufacturing, corrections, public transit, grocery, and U.S. Postal Service jobs. This is a brief list that could be updated in the future. And once again, the CDC and DHS communicated that this group may get a Pfizer booster dose based on their individual assessment of risk and benefits. We do want to stress that the vaccines work, and the need for boosters is an effort to keep vaccine effectiveness levels, which naturally decline over time, at optimal levels. The COVID-19 vaccines continue to be remarkably effective in reducing risk of severe disease, hospitalization, and death, including against the Delta variant. We continue to see high effective protection against hospitalizations and severe outcomes for people who are fully vaccinated. It's worth stating again that the science and the virus evolves, so do federal, state, and local policies and recommendations. Booster doses are common for many vaccines. The scientists and medical experts who developed the COVID-19 vaccines continue to closely watch for signs of waning immunity. How well the vaccines protect against new mutations of the virus are also studied in addition to how that data differs across age groups and risk factors. We expect additional guidance from CDC in the future about other booster dose needs. Pfizer was the first vaccine approved in the United States, so we have the most data available on that vaccine. As time passes and we have more data on the Moderna and the Johnson & Johnson vaccines, we expect to know more about possible booster dose recommendations for these vaccines as well. To find a booster dose near you, please visit vaccines.gov, call 211, or visit rockcountyshot.com. The supply of vaccines in Wisconsin is still enough to continue providing vaccines to anyone who is eligible and not yet receiving 1 or 2 doses of the vaccines. I'll pass it back to you, Jessica.
Thank you, Katrina. And we will now go to Seth for some additional updates before we move into our question.
Great, thank you, Jessica. Next week, we are also beginning a new effort to provide COVID-19 and flu vaccine clinics at area schools to make securing these critical vaccines more convenient and accessible for Rock County youth. We all know how important vaccination is to slowing the spread of COVID. With flu season approaching, the risks of respiratory illness are even greater and could compound issues. Last year, we had a very light flu season in terms of overall cases. However, given relaxed COVID mitigation measures in parts of the country, increased air travel, and the return of many students to in-person learning, it's likely the US will experience a more significant influenza season compared to 2020. The flu vaccine doesn't protect you from COVID-19, but it could reduce flu symptoms that can be confused with COVID-19 symptoms. And diagnosing each illness correctly is important as they are treated differently. The flu vaccine can also help lessen the impact on healthcare providers and hospitals by reducing the number of people with severe flu and hospitalized with the flu. The 3 COVID plus flu vaccine clinics we have scheduled so far include Franklin Middle School in Janesville on October 5th from 4 p.m. to 7 p.m., Marshall Middle School in Janesville on October 18th from 4 p.m. to 7 p.m., and Beloit Turner Middle High School on October 25th from 1 p.m. to 5:30 p.m. We are partnering with the schools and community health systems of Beloit to offer these clinics. They are free and open to the public, and walk-ins are welcome. At the clinics, COVID-19 vaccines will be available to those ages 12 and older, including adults, while flu vaccines will be available for children and teens ages 6 months to 18 years old. Minors will need parental consent and should be accompanied by a parent or guardian. If a parent or guardian is not able to attend, they should call our COVID line at 608-352-6727 to discuss options. To register and learn more, please visit rockcountyshot.com and 211.com. Stay tuned as we move forward for more similar dual vaccine clinic options. We strongly encourage everyone to get their COVID-19 and flu vaccines administered together or separately to help us continue to reduce infection rates and related hospitalizations in the most efficient way possible. It's the last chance for DHS $100 reward for vaccination for Wisconsin residents vaccinated between August 20th and September 19th. Today is the last day to receive a $100 US Bank Rewards gift card under the Wisconsin COVID-19 Vaccine Reward Program. If you received your first vaccine shot during that time frame, don't forget to visit 100.wisconsin.gov or phone 844-684-1064 to claim your $100 reward. And if you haven't yet been vaccinated, please do so. To find COVID-19 vaccine providers and opportunities in Rock County, visit rockcountyshot.com or vaccines.gov, vacunas.gov for Spanish, or phone 877-942-2211. If you need transportation assistance, you can phone 211. Last but not least, today we are announcing a new location for the DHS AMI community-based vaccine clinic in Rock County beginning next Tuesday, October 5th. The clinic, currently located at Blackhawk Technical College, will be moving to the Rock County Job Center building located at 1900 Center Avenue in Janesville. The hours will remain the same, Tuesday from 11 a.m. to 5 p.m. and Thursday from 11 a.m. to 3 p.m. The clinic offers free COVID-19 vaccines to everyone ages 12 and older. Identification or proof of residency is not required. However, minors must be accompanied by a parent or guardian. To schedule a vaccination at the clinic and to check on the latest hours, visit vaccinate.wi.gov or phone 844-684-1064. Again, free rides are available by calling 211. Immediately after the briefing, we'll send out a press release confirming the information we just shared. That is all for my updates. Back to you, Jessica.
Thank you, Seth. Before we go into questions, I just want to confirm that the new location for the AMI vaccination clinic is going to be at the former Job Center location. And the address for that is 1900 Center Avenue, as Seth mentioned. But I just wanted to confirm that that's not the new Job Center building, it's the former Job Center building. So we will go into questions now. It looks like today we have one media partner in attendance. We have Austin Montgomery from the Beloit Daily News. Thank you for joining us, Austin. We will give you the ability to mute and unmute yourself, and you can go ahead and ask any questions that you have.
Thanks for hosting this again, guys. Just one question today. I think it's probably best directed at Nick, but I'm not sure how you want to divvy that up. But in June, we had talked about the possibility of seeing some sort of increased surge heading into the fall and winter. Have we avoided kind of the worst case scenario? And is the county's rate of infection, has it reached some sort of plateau? Just wanted to kind of get a sense of kind of looking back at where we were when we talked in the summer to where we are now. Thank you.
Yeah, that's a great question. I think I wish I could answer this with 100% certainty in terms of, when we're past a peak and when we plateaued. One of the complicating factors also was most recently there was a little data glitch from the statewide system that caused some variation in the trends that made things look like they were vastly improving and then getting worse. But essentially, when we're looking at the data, we're still seeing slight increases in case activity, and we're seeing slight increases in the number of active cases that are in Rock County right now. So unfortunately, I can't say that we have plateaued. We have kind of not seen the level of increase that we saw at this point last fall, which I think is a good thing. We're not seeing drastic levels of case activity increasing on a week-to-week basis, but we are seeing high level of spread. And when we look at the case activity, 37 new cases per day is quite a bit higher than we would want to see based on the CDC thresholds for community spread in a county. So, the good news with the case activity that we're seeing right now is we're not seeing the level of increase that we saw previously, but we aren't seeing a decrease in case activity that would lead me to believe that we've kind of avoided a peak that could extend to beyond kind of what we saw last fall. I think the good news is that we're still seeing increases in people getting vaccinated. And if we really want to see the numbers start to plateau and decrease, we need more and more people to get vaccinated. And that's really going to be kind of the bottom line here is as many people as we can get vaccinated, that's going to lead us out of the pandemic. We need people to be vaccinated so that they're not getting COVID. And if they are, their symptoms are greatly reduced. Right now, we're in a decent spot in terms of the numbers where things are not reaching the level of urgency that they were last fall, but that doesn't mean that we won't get to that point. If people kind of revert to not wearing masks and we don't get more people vaccinated. So really, we just strongly ask that people get vaccinated. If you have questions about the vaccine, talk to your healthcare provider about those questions, and together we'll move beyond COVID, hopefully soon.
Thanks, Nick. Do you have any additional questions, Austin?
Nope, no more questions. I know we had talked earlier in the week on booster doses, so just looking forward to that other information about the upcoming dual clinics and things like that. So thank you.
Great, thank you. And thank you for participating, Austin. So that will conclude our media briefing for this week. Just a reminder that this has been live streamed on our Facebook page. The recordings will be available on our Facebook page and our YouTube channel after we conclude the briefing. We want to thank everyone for watching. And if you're a member of the media and would like to participate in a future media briefing, you can send an email to me at media.publichealth@co.rock.wi.us, and I can provide you with the information to participate. So be safe and be healthy, everyone. We'll see you in a couple weeks.